Hi, I'm Jackie Vanderlinde, a registered nurse on the observation unit at Sentara Martha Jefferson Hospital in Charlottesville, Virginia. I am also a BSN student at Mary Baldwin University, Murphy Deming College of Health Sciences. I wanted to share with you today my capstone project I've been working on, which is complementary and alternative medicine versus opioid medication alone. Pain is the most common reason people seek medical attention. As nurses, we know pain to be considered the fifth vital sign, and it is subjective. Patients can present with chronic pain, acute pain, and it is most often treated with opioids. However, the overuse of opioids has become a national crisis. Risks associated with opioid use are misuse, addiction, overdose, and death. The use of integrative health care, which is the combination of traditional medicine with complementary alternative medicine, or CAM therapies, is growing in the United States. So this brings us to our PICO question, which is, in adult patients with pain receiving care on the observation unit, how does the use of complementary and alternative medicine compare to the administration of opioid medication alone? There is strong evidence to support the use of CAM therapies to manage pain and reduce opioid use. In addition, there is some question as to the efficacy of opioid medication for the treatment of chronic pain. In a study for acute neck pain, they used spinal manipulation and some home exercises which showed evidence that the treatment was effective for treating that pain. Another study of New England of 42 participants with a comparison group and a treatment group, the comparison group actually increased over a 2-year period, increased their use of opioids, whereas the treatment group, which they attended yoga, Tai Chi, guided imagery, and visualization, and their pain was managed, and even the doses were reduced, and some even stopped using opioids. So this validates the effectiveness of CAM for pain management. In another review, researchers examined evidence of a group of people taking opioids and the effect of massages, and 90% reported that the treatment was helpful. A systematic review by Polson and Cotto found evidence to support complementary and alternative therapies such as music can reduce pain and the use of opioids. So moving on to our evidence-based change, according to the CDC, there has been approximately 400,000 deaths between 1999 and 2017 related to opioid overdose. The number of deaths continues to increase, as the number of deaths related to opioid use is 6 times higher in 2017 compared to 1999, with an average of 130 deaths per day in the United States related to opioid overdose. The side effects of the opioids include tolerance, dependence, increased sensitivity to pain, insomnia, constipation, nausea, confusion, and depression. And then the risks, as we discussed earlier, include misuse, addiction, overdose, and death. So in order to combat this serious epidemic, there is strong evidence to support the use of complementary and alternative therapies, which include but are not limited to massage, acupuncture, music, yoga, aromatherapy, guided imagery, prayer, and meditation. The research suggests CAM therapies improve pain, sleep, mood, and overall well-being. There is strong evidence to support the use of integrated healthcare, including CAM therapies, to manage pain. Therefore, opioid use is reduced, which potentially reduces the risks associated with opioids, including addiction, overdose, and death. So that brings us to our case example of a 26-year-old male who presented to the ED with generalized pain and weakness. He had a previous medical history of sickle cell anemia and had frequent admissions to the hospital for sickle cell crisis over several years. Overall, his physical assessment was within normal limits. However, he rated his pain a 10 out of 10 for generalized body pain. The patient was admitted for pain control. His treatment plan to manage the pain with opioids, including 4 milligrams of IV Dilaudid every 3 hours as needed, and 30 milligrams of oral oxycodone every 4 hours as needed. Despite strict adherence to his pain medication administration, when the nurse assessed his pain level 1 hour after each administration, the patient's pain rating was never reported below a 6 out of 10. Ultimately, during subsequent admission for sickle cell crisis, the patient crushed a Benadryl tablet he had in his belongings and used a syringe to inject the medication through his IV and ultimately died. Unfortunately, for patients with certain chronic diseases like sickle cell anemia, pain is unavoidable. Over time, these patients require more pain medications as they develop tolerance, and in an attempt to control their pain, sometimes leading to opioid dependence and abuse. So, could the additional use of complementary and alternative medicine reduce the amount of opioids needed for pain management? And there is strong evidence to support this, this practice change. So the recommendations to initiate this change would be to begin with the internal stakeholders that would be involved would include the unit coordinator, the unit manager, unit director, nurse director, the educational coordinator, and I would include the safety coordinator. In addition to that, physicians, surgeons, physician assistants, the nurse practitioners would also be involved in the decision process to allow changes to their treatment plan for pain. There are 10 nurses and 4 nurse care partners on the observation unit that would need to be educated through PowerPoints, demonstrations, and handouts. The education would occur during staff meetings and at the nurse's station during shift and at the patient's bedside. Progress would be monitored monthly for adjustments in the practice change, with quarterly evaluations with team leadership to determine the efficacy of the CAM therapy's treatment of pain and opioid usage. Audits in EPIC will be a key factor in measuring the outcomes of the CAM therapies. Any changes will be shared with the nursing staff during monthly staff meetings and updates sent to all interdisciplinary team members via email. Since many alternative therapies do not require any extra expense, there is no anticipation of additional financial resources for the proposed change. The proposed change could be impacted by low staffing ratios and high patient census and acuity and high acuity. Staff could be deterred to provide the additional therapies if the unit is drowning. Offering complementary and alternative therapies should allow for a more inclusive approach with more values and cultural preferences to be included in patient treatment. And then the proposed change would be applicable to the 12-bed observation unit. However, the data would be gathered and used to support CAM in other units of the hospital to reduce opioid usage and manage pain. Future considerations would be that there is strong evidence to support the CAM therapies. However, more research is needed in complementary and alternative medicine for pain management and addiction. Another consideration would be to ensure that the change practice is sustained through education, continued sharing of the vision, and celebrating short-term successes with the change. Protocols should be in place for the use of complementary and alternative therapies. However, as with all treatment, patients' rights are guaranteed. Another consideration is to stay current on evidence-based research for complementary and alternative therapies to ensure best care and best patient outcomes. And thank you for your time joining me today, and